What is COVID-19? COVID-19 comes from the coronavirus family. They can cause illnesses ranging from the common cold to Middle East respiratory syndrome and severe acute respiratory syndrome. Common signs of infection include fever, cough, shortness of breath, and breathing difficulties. Prevention: regularly washing your hands, cover your mouth and nose when sneezing or coughing, thoroughly cooking meat and eggs, and social distancing. Here are some things you should know about COVID-19. The virus is primarily spread between people during close contact, most often via small droplets produced by coughing, sneezing, and talking. As is common with infections, there is a delay between the moment a person is first infected and the time he or she develops symptoms. This is called the incubation period. It can range from 1 to 14 days. Where did it all start? It was first identified in Wuhan, China. The first case may be traced back to November 17, 2019. It is believed to have been transmitted to humans from bats. As of 5th of June 2020, more than 6.63 million cases have been reported across 188 countries and territories, resulting in more than 391,000 deaths. In the United States, there are more than 1.92 million cases and 110,179 deaths.
Hello to all ladies and gentlemen out there. I would like to acknowledge you all about the outbreak of coronavirus disease 2019, COVID-19, that has created a major global health crisis that has had a deep impact on the way we perceive our world and our everyday lives, especially in United States of America. Today's hot topic is about the progress of how the President of United States Donald Trump mishandled COVID-19 outbreak in U.S. Approximately 16.8 million Americans were put on furlough in a span of 3 weeks, which is more than 10% of the American workforce. U.S. President Donald Trump announced major disaster in all 50 states for the first time in U.S. history. As early as December 31, 2019, the U.S. Centers for Disease Control and Prevention, CDC, caught a cluster of 27 cases of pneumonia of unexplained origin in Wuhan on the same day that China reported the same number of pneumonia cases of idiopathic causes in China. On January 1, President Donald Trump voiced his first comments about the disease, a day after the U.S. confirmed its first case in Seattle. "We have it totally under control," the president sounded sanguine. WHO issued its first disease outbreak news and a technical guidance on how to detect, test and manage cases to all countries, while China health authorities identified the virus and publicized its genetic formation. CDC failed in implementing concrete prevention and control measures besides waving a red flag against Americans traveling to Wuhan. Over the next few days, Washington was striking travel restrictions from China and evacuating American citizens from Wuhan. Peter Navarro, Trump's long-term advisor, wrote a note warning of more than 500,000 American deaths in late January. One day after the WHO revealed the coronavirus as public health emergency of international concern, the U.S. announced a public health emergency over the virus, on the last day of January. In early February, soon after the U.S. issued travel warnings, the Food and Drug Administration, FDA, allowed the authorization for the urgent use of the CDC inspection. 2 days later, the CDC was disseminating the diagnostic test kits to labs across the nation. On February 17, the U.S. deported 300 American passengers aboard the Diamond Princess, and some of them were positive with the infection. Trump appointed Vice President Mike Pence to lead the virus task force, but the federal response was twisty. The CDC and the FDA then distributed new test kits to public laboratories to mention undetermined aftermath given by the previous diagnostic kits. On the end of February, the U.S. recorded its first death from coronavirus.
On March 6, Trump told that anybody who wants a test will get a test. While traveling the CDC facilities, knowing that testing kits are in short and the issue plagued many hospitals across the country. 3 days later, he stated that the virus would go away, just stay calm. WHO announced the global pandemic of COVID-19 on 11th of March. Although most of the states in U.S. weak in implementing action, the CDC invented a guidance recommending to call off group gatherings of over 50 people. But the advisory did not have the force of law because it was simply cautionary. Local governments varied in their recommendations and warnings. San Francisco Bay Area practiced the 3-week lockdown on March 17, with New York City following suit 5 days later. On March 26, the country became the new hotbed of the pandemic issue as it led the number of reported coronavirus cases.
Trump informed in a political rally in New Hampshire that, when it stays a little warmer, the viral outbreak miraculously goes away. The WHO declared there is no medical reason that the virus behaves differently in different temperatures. President Donald Trump had barely distanced himself from statements that malaria treatment could cure the coronavirus before he had moved on to another, even more unorthodox suggestion of disinfectant. "I see the disinfectant where it knocks it out in a minute," Trump said. 1 minute. "And is there a way we can do something, by an injection inside or almost a cleaning? It sounds interesting to me." Reactions were, as one would expect, quite swift. The death toll of which in USA already eclipsed the number of those killed by the September 11th attacks.
We are facing a global health crisis. What are the efforts taken by the USA in handling COVID-19 pandemic? Let's start off by talking about the positive efforts made by the United States. Number 1. Stimulus Goliath. According to BBC, the U.S. Congress passed a $2 trillion coronavirus relief bill, which included direct cash payments to all Americans, expanded unemployment assistance, also include massive aid to states, especially the hardest hit areas, healthcare facilities, and other public services, support for hardest hit industries, and loans to small and medium-sized businesses that can be forgiven if they avoid layoff. It was a massive, record-breaking piece of legislation that was the result of negotiations involving Democratic and Republican leaders in Congress, as well as Treasury Secretary Steve Mnuchin and his deputies. Number 2. Research firepower. if the coronavirus is exposing some of the flaws in the US healthcare system, it also could end up highlighting the strength of the nation's research and drug development infrastructure. Number 3. State leadership. The U.S. federal system of government, which delegates broad powers to individual states, has proven to be both a blessing and a curse. In good times, it allows local leaders to experiment individually with various public policy solutions, testing out best practices that can then be adopted across the nation. In the case of a deadly pandemic, however, a patchwork response can be inadequate and result in avoidable deaths and economic disruption. Every governor is making decisions on their own. Levi says. Some are making good decisions. Some are not. He points to governors like Gavin Newsom of California and Jay Inslee of Washington, who took early steps to close schools and issue shelter-in-place orders that have resulted in a slower spread of the virus in their populations. Ohio Governor Mike DeWine has also received praise from many quarters for his decisive early moves that at the time were viewed by some as too drastic.
For the negative efforts taken by the United States. The first would be shortage in medical supplies. Masks, gloves, gowns and ventilators. Doctors and hospitals across the country, but particularly in areas hardest hit by the pandemic, are scrambling for items essential to help those stricken by the virus and protect medical professionals. The lack of adequate supplies has forced healthcare workers to reuse existing sanitary garb or create their own makeshift gear. A shortage of ventilators has state officials worried they will soon be forced into performing medical triage, deciding on the fly who receives the life-sustaining support and who doesn't. Next would be the testing shortcomings. Trump stood in the Rose Garden in front of banners declaring America leads the world on testing to the reporters. He touted the $11 billion the federal government would be giving to states to wrap up their testing programs, and the 9 million coronavirus tests that have been given in the U.S. so far, including a current rate of more than 300,000 a day. On March, Vice President Mike Pence promised that the U.S. would hit 4 million coronavirus tests a week. That number wasn't achieved until the end of April. In mid-March, Trump touted a public-private partnership to offer drive-through testing at shopping centers across the nation. A month later, only a handful had opened. Even now, the U.S. has only tested 2.74% of its population, which puts it well behind many industrialized nations. And even the current, higher rate of test is not near the mark of 900,000 a day that a Harvard University estimate indicates is necessary to reliably identify potential virus hotspots across the country before they become major outbreaks. Next would be the failure of the American citizens to follow the social distancing policy. Across the country, there have been numerous examples of Americans failing to heed the calls by public health professionals to avoid close social contact, sometimes abetted by local and state government officials who have been reluctant to order businesses to shutter and citizens to shelter in place. Even steps taken with the best of intentions might have had adverse consequences, like curtailing public transportation services, may have led to trains, buses and planes that were more crowded. Universities that sent students home to their families may have contributed to the spread of the virus by returning infected individuals to cities, neighborhoods, and homes not yet in full lockdown.
Coronavirus pandemic has unleashed chaos on the world. Governments and organizations are scrambling to manage and contain the deadly virus from spreading further. Now let's compare Malaysia and us in regards of COVID-19. As of the 16th of April, more than 2 million people have been infected worldwide and over 1 lakh have succumbed to the deadly virus. In Southeast Asia, 22,174 confirmed cases have been reported across the 10 ASEAN and member states as of the 15th of April. Meanwhile, United States of America have 6,61,712 number of positive COVID-19 cases. Malaysia's strategies in attempting to break the chain of infection appears to be successful so far. Contradictingly, United States shows a much higher data of infection and death rate. What have Malaysia been doing to flatten the coronavirus curve in the country compared to United States of America? Malaysia is doing a better job than US in handling coronavirus pandemic. The enforcement by the authorities in Malaysia to control the spread of the novel coronavirus. It is explained that the first world country handled the pandemic was vastly different to the way Malaysia handled. The first world country was far behind Malaysia in terms of enforcement. Strategies were implying movement control order. Authorities hoped that this could break the chain of infections and flatten the curve. A study which stated that Malaysia could see a surge in COVID-19 cases in mid-April resulting in stricter MCO. Roadblocks have been implemented across the country and a curfew has also been imposed for all vehicles, including e-hailing, from 10 p.m. to 6 a.m. daily. Other than that, any kind of gatherings is also prohibited, including the much-anticipated Ramadan bazaars, typically held yearly throughout the whole fasting month. Malaysia are following the South Korean model to test everyone. By testing everyone, we can detect positive cases early and help minimize the spread of COVID-19. The Ministry of Health is working to optimize the use of existing laboratories in the country by shifting its strategy to conduct an antibody test, serology, instead of a polymerase chain reaction, PCR, test for those who have been in close contact with COVID-19 patients and have been quarantined. Coronavirus is exposing all of the weaknesses in the US health system. Americans may avoid medical care, even for serious conditions, because of the costs. Hospitals will need rooms for the people who require close monitoring in a clinical setting, and ICU beds and ventilators for patients who take a turn for the worse and require mechanical support to keep their bodies functioning. Future preparations to combat this pandemic is essential. Understanding what went right for Asia and wrong for Western countries may be a good place to start, as US has officially more COVID-19 deaths than China. Every crisis is an opportunity, and there will be many opportunists in the mix. Forcing more regulations on healthcare institutions to be pandemic certified will only give us the illusion of safety, yet too little to protect us from another unexpected pandemic. Crowdsourcing data and leveraging technology should be the new strategy for arming healthcare epidemiology with all the tools available in the 21st century. Grant biotech companies and laboratories access to develop tests and vaccines to create a responsible and productive pandemic-prepared biotech sector.